It's 2:30 in the morning, and you jolt awake with a burning sensation rising like molten lava up your throat, your heart racing, gasping for air as acidic liquid shoots into your mouth, and you're frantically reaching for that bottle of antacids on your nightstand for the third time this week. Sound familiar? I'm Dr. Michael Hayes, board-certified gastroenterologist with 22 years of experience treating digestive disorders. And if you're over 50 years old and experiencing nighttime reflux, I need to warn you about something critical that could be destroying your esophagus while you sleep. The sleeping position you're using right now, the one that feels natural and comfortable, the one you've probably been using for decades, could be causing permanent damage to your digestive system. And tonight, I'm going to show you exactly why this happens and how to fix it before it's too late. This is educational content only, not medical advice, and you should always consult your healthcare provider before making changes to your health routine. But what I'm about to share with you is based on decades of clinical research and thousands of patient cases I've personally treated. Let me tell you about Margaret, a 63-year-old retired teacher from Florida who walked into my office 6 months ago looking absolutely exhausted. Dark circles under her eyes, her voice raspy and strained. And when I asked her how she was sleeping, she broke down crying right there in my examination room. Margaret told me she hadn't slept through a full night in over 2 years, waking up multiple times choking on acid, her throat burning so badly she thought she was having a heart attack the first few times it happened, and she'd spent thousands of dollars on medications, special pillows, wedge cushions, even tried sleeping sitting upright in a recliner. Nothing worked. She was taking omeprazole twice a day, popping antacids like candy, avoiding all her favorite foods, and still waking up in agony every single night between 2 and 4 in the morning. When I asked her which side she slept on, she said she'd been a right-side sleeper her entire life. It just felt natural, comfortable, the way her body wanted to position itself. And that's when I knew exactly what was destroying her esophagus. You see, after age 50, everything changes in your digestive system. The lower esophageal sphincter weakens. Stomach acid production can actually increase in some people while the protective mechanisms decrease. And the position you sleep in becomes absolutely critical because gravity is either working with you or against you. Margaret was sleeping on her right side, which is the worst possible position for anyone with reflux, but it's especially dangerous after 50 when your body's natural defenses are already compromised. Here's what was happening inside Margaret's body every single night, and this is probably happening inside your body right now if you're making the same mistake. Your stomach sits on the left side of your abdomen, and the esophagus, that muscular tube connecting your throat to your stomach, connects at the upper left portion of your stomach through a valve called the lower esophageal sphincter. When you sleep on your right side, your stomach is now positioned above the esophageal junction, and gravity, which should be your friend, becomes your worst enemy because it's literally pulling stomach acid directly toward that sphincter and up into your esophagus. Think about it like a bottle of water lying on its side. If you position it with the cap pointing downward, the water flows right out. But if you position it with the cap pointing upward, the water stays inside. That's exactly what's happening with your stomach and esophagus. When you're on your right side, the gastric acid pools right at the junction where your esophagus meets your stomach. And with every breath, every slight movement, every time your lower esophageal sphincter relaxes even slightly, which happens naturally during sleep, that acid is flooding up into your esophagus, bathing the delicate tissue in hydrochloric acid that's strong enough to dissolve metal. After 50, your lower esophageal sphincter doesn't close as tightly as it used to. The muscle tone decreases. You might have a slight hiatal hernia that you don't even know about, and your saliva production decreases at night, which means less natural acid neutralization. So every single episode of reflux causes more damage than it would have when you were younger. Margaret had been doing this for years, decades even, and the damage was accumulating night after night. Her esophageal lining was inflamed, showing early signs of Barrett's esophagus, a precancerous condition that develops when chronic acid exposure causes the cells lining your esophagus to change in an attempt to protect themselves. Quick question before we continue. Are you subscribed to this channel yet? If not, do it right now. Because every week I answer questions from subscribers and create content based on what you need to know most. And I want to make sure you don't miss critical information that could prevent serious health complications down the road. Now let's talk about what's actually happening inside your esophagus right now, because understanding the mechanism is crucial to understanding why the solution works. Your esophagus is lined with delicate squamous epithelial cells. They're designed to handle food and liquid passing through, not repeated exposure to gastric acid that has a pH of 1.5 to 3.5, which is incredibly corrosive. When acid refluxes up into your esophagus, it causes immediate inflammation. The tissue becomes red, swollen, irritated, and if this happens repeatedly, night after night, week after week, year after year, your body tries to adapt by changing the cell type in your esophagus from squamous cells to columnar cells, which are more resistant to acid. This is called metaplasia, and it's the first step toward Barrett's esophagus. Here's what most people don't realize. The damage doesn't just happen during the reflux episode itself, it continues for hours afterward because that acid sitting in your esophagus creates an inflammatory cascade. Your immune system responds, white blood cells rush to the area, inflammatory cytokines are released, and all of this causes tissue damage, scarring, and eventually can lead to strictures where your esophagus narrows, making it difficult to swallow. Margaret's endoscopy showed moderate esophagitis with areas of erosion, basically ulcers in her esophagus, and several patches of intestinal metaplasia. She was on the path towards serious complications, and the frightening part is she had no idea how bad it was because she thought nighttime heartburn was just a normal part of aging. The anatomy is crucial here. Your stomach is shaped like a J, and when you're on your left side, the natural curve of your stomach positions the gastric contents away from the lower esophageal sphincter. Gravity pulls everything down toward the greater curvature of the stomach, away from that critical junction. The esophagus enters the stomach at an angle, called the angle of His, and this angle works much better when you're on your left side because it creates a valve-like mechanism that helps prevent reflux. On your right side, you lose this anatomical advantage completely. The angle flattens out, the sphincter is positioned lower than the bulk of your stomach contents, and every time you breathe, shift position, or your stomach contracts, acid is pushed right up into your esophagus. After 50, you might also have decreased muscle tone throughout your entire digestive tract, slower gastric emptying, which means food sits in your stomach, longer producing more acid, and reduced protective mucus production in your stomach lining. All of these factors combine to make nighttime reflux significantly worse and more damaging. Be honest in the comments. Which sleeping position have you been using? Right side? Back? I need to know what we're working with here. And I read every single comment because your experiences help me create better content that addresses real problems. Now imagine with me what tomorrow morning could look like if you make the change tonight. Instead of waking up at 2:30 with that horrible burning sensation, you sleep peacefully through until your alarm goes off at 6:30 or 7 o'clock in the morning. You wake up without that sore throat, without that raspy voice, without that bitter acidic taste in your mouth, without needing to immediately drink water to wash away the burning. Your throat feels normal, your chest doesn't hurt, you don't have that tight, uncomfortable feeling behind your breastbone, and you actually feel rested because you slept through the entire night without interruption. This isn't a fantasy, this is what happens when you sleep in the correct position and allow your anatomy to work with gravity instead of against it. Margaret experienced this transformation, and I'm going to tell you exactly how, but first you need to understand what 1 week of proper sleep positioning can do for your esophagus. After 7 nights of sleeping on your left side with proper elevation, which I'll explain in detail, your esophageal tissue begins the healing process, the inflammation starts to decrease, the constant acid exposure stops, and your body can finally begin repairing the damage that's been accumulating for months or years. You'll notice the frequency of nighttime reflux episodes drops dramatically, maybe from 3 or 4 times per night down to once or not at all. And even when reflux does occur, it's less severe because the acid isn't pooling at your esophageal junction. It's being pulled away by gravity. Your sleep quality improves significantly. You're spending more time in deep restorative sleep instead of constantly being jolted awake by burning acid, and this has cascading effects on your entire health. Better energy during the day, improved mood, better cognitive function, reduced stress hormones, and even better blood sugar control because quality sleep affects insulin sensitivity. Margaret told me that after 1 week she felt like a different person. She had energy to exercise again. She wasn't irritable and exhausted all day. She could think clearly, and most importantly, the constant fear and anxiety about going to bed disappeared because she wasn't dreading the inevitable nighttime wake-ups. Now let's jump ahead to 1 month of consistently sleeping in the correct position. Your esophageal lining has had time to heal significantly, the erosions are closing up, the inflammation is way down, and if you had early metaplastic changes, they may even begin to reverse, though this requires medical monitoring and can take many months. Your lower esophageal sphincter, even though it's weaker after 50, is under much less stress because you're not constantly forcing it to fight against gravity and acid pooling, so it can function at its maximum capacity even if that capacity is reduced compared to when you were younger. You might find that you can start reducing your medication, under your doctor's supervision of course, because you're addressing the root mechanical cause of the problem instead of just suppressing acid production with drugs. Margaret was able to cut her omeprazole dose in half after 6 weeks, and by 3 months she was only taking it occasionally when she knew she'd eaten something triggering. This saved her hundreds of dollars per year in medication costs and eliminated the potential side effects of long-term proton pump inhibitor use like increased fracture risk, decreased magnesium and B12 absorption, and potential increased infection risk. Your overall quality of life improves dramatically because chronic sleep deprivation affects everything. Your relationships suffer when you're exhausted and irritable. Your work performance declines. Your risk for accidents increases. Your immune system weakens. And your risk for serious health conditions like cardiovascular disease, diabetes, and cognitive decline all go up. 1 month of good sleep because you fixed your sleeping position can literally change your entire life trajectory. So how exactly do you achieve this transformation? Let me give you the complete protocol that I gave Margaret and that I give to every single patient over 50 who comes to me with nighttime reflux. Step 1. Dinner timing. This is absolutely critical and non-negotiable. You must stop eating at least 3 to 4 hours before you go to bed, period. If you go to bed at 10 o'clock at night, your last meal needs to be finished by 6 or 6:30 in the evening at the absolute latest. Here's why this matters so much. When you eat, your stomach produces acid to digest the food. This is normal and necessary, but it takes approximately 3 to 4 hours for your stomach to empty a regular meal. And during that entire time, your stomach is full of food mixed with concentrated acid. If you lie down while your stomach is still full and actively digesting, you're giving gravity a pool of acidic material to pull right up into your esophagus. It doesn't matter what position you sleep in. If your stomach is full, you're going to have reflux. After 50, your gastric emptying slows down, so what used to take 3 hours to digest might now take 4 or even 5 hours, which means you need to allow even more time between eating and lying down. Margaret was eating dinner at 8 or 8:30 and going to bed at 10. This was guaranteeing reflux every single night regardless of anything else she did. I had her move dinner to 5:30 or 6 o'clock, and just this change alone reduced her symptoms by about 30%. If you absolutely must eat something late, choose something very small and low acid. A small banana, a few whole grain crackers, a small serving of oatmeal, not a full meal, not anything fatty or acidic or spicy, just something minimal to take the edge off hunger. Step 2. Bed elevation. You need to elevate the head of your entire bed by 6 to 8 inches. And this is where most people make a critical mistake. They try to elevate just their head with extra pillows. This does not work and actually makes reflux worse because it creates a bend in your torso that increases abdominal pressure and pushes acid up. You need to elevate the entire upper portion of the bed frame itself using blocks or risers under the legs at the head of the bed, or use a bed wedge that goes under your mattress and creates a gradual incline from your hips to your head. This costs about $20 to $50 for blocks or a wedge, and it's one of the best investments you can make because now gravity is working with you even more effectively. Acid has to flow uphill to reach your esophagus, and this provides protection even if you shift positions during the night. Margaret bought 6-inch bed risers for $30 and placed them under the 2 legs at the head of her bed, creating a gentle slope that made a huge difference. Step 3. Left side sleeping position. This is the crucial change we've been discussing. You need to train yourself to sleep on your left side, and I know this can be challenging if you've been a right side or back sleeper your whole life, but it's absolutely essential. Here's how to do it. Lie on your left side with your left arm extended slightly forward or bent under your pillow, not tucked under your body, which can cause shoulder pain. Place a pillow between your knees to keep your spine aligned and reduce hip stress, and use another pillow or body pillow against your back to prevent you from rolling onto your back or right side during the night. Your upper knee should be slightly flexed and resting on the pillow. This keeps your pelvis neutral and prevents lower back pain. If you wake up on your right side or back, don't get frustrated. Just roll back to your left side. It takes about 2 to 3 weeks for your body to adjust and start preferring this position naturally. Margaret used a body pillow, and after about 10 days, she was staying on her left side for most of the night. Step 4. Pre-sleep ritual. After dinner, take a 10 to 15-minute walk. This aids digestion and helps your stomach empty faster. Then spend the rest of your evening in an upright position, sitting or standing, not lying on the couch. Wear loose-fitting clothing, especially around your waist and abdomen. Tight clothing increases abdominal pressure and promotes reflux. Avoid alcohol for at least 3 hours before bed, because alcohol relaxes the lower esophageal sphincter and increases acid production. Avoid caffeine for at least 6 hours before bed for the same reasons. Stay completely upright for at least 2 to 3 hours after eating. No reclining, no lying down, no slouching. Sit up straight or stand. Margaret implemented all 4 of these steps simultaneously, and within 3 days she noticed improvement. Within 2 weeks she was sleeping through most nights, and within 6 weeks her endoscopy showed significant healing of her esophageal lining. This is educational content meant to complement, not replace, medical care from your healthcare provider. Individual results may vary, and you should always consult with your doctor before making changes to your treatment plan, especially if you're currently taking medications for reflux. Now I need to give you critical information about when to seek immediate medical attention, because not all chest pain or throat discomfort is simple reflux. Seek immediate medical attention if you experience severe chest pain that radiates to your arm, jaw, or back, difficulty swallowing solids or liquids that's getting progressively worse, vomiting blood or material that looks like coffee grounds, black tarry or bloody stools, unexplained weight loss of more than 10 pounds over a short period, persistent heartburn despite medication and lifestyle changes that doesn't improve, chronic cough with blood or severe shortness of breath, hoarseness lasting more than 2 weeks, pain when swallowing accompanied by fever, or choking episodes during sleep that are increasing in frequency or severity. Call 911 immediately if you have chest pain with sweating, shortness of breath, or pain radiating down your arm, as these could indicate a heart attack, not reflux. Heart attacks and reflux can feel very similar, and it's always better to be safe and get checked out. Patient details in the examples I've shared have been changed to protect privacy. If this video helped you, I need 3 things. First, smash that like button because it tells YouTube to show this to more people who are suffering. Second, share this video with anyone you know who complains about heartburn or takes antacids regularly. You could literally save them from years of damage. Third, comment below committing to one specific change you're making tonight, because accountability matters. And if you're not subscribed, what are you waiting for? Hit that button now.